Hello, I am Linda Sarna, Dean of the UCLA School of Nursing. Before we begin today's pre-recorded ceremony, I want to acknowledge the very painful events of the past 2 weeks that have highlighted the discrimination, health disparities, and health inequities present in our communities, especially among people of color. Many ask, what can I do? As nurses, as the most admired professionals, you have the opportunity and the responsibility to take action and use your voice, to change the system and to reduce these disparities. Be inspired today by the words of Dr. Alicia Georges, our keynote speaker, who will provide guidance about how you and we can make a difference. Now, let the ceremony begin. Welcome to the candidates for Advanced Practice Registered Nurse, Masters of Science in Nursing, Class of 2020. We will start with the Star-Spangled Banner performed by Jessica Hange, Acute Care Nurse Practitioner.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight, o'er the ramparts we watched, were so gallantly streaming, and the rockets regular, the balls bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Hello, everyone. I'm Linda Sarna, and I have the honor and privilege to serve as Dean for the UCLA School of Nursing. Welcome to our 2020 Commencement ceremonies. Commencement is the highlight of the academic year, honoring and symbolizing academic success and personal achievement for each of you graduating today. It's a collective opportunity for faculty, families, and friends to celebrate this milestone. Some of you will be entering the profession as new nurses. Others will now be recognized as advanced practice nurses, and some of you will become nurse leaders and scientists. All of you are heroes in my book. I know we had all hoped to be together in Royce Hall today, and I share your disappointment that we are not. No one could have predicted that we would be in the midst of a pandemic, where we would not be able to gather in a way that allows us to remain at a safe distance from one another. However, we will do our very best to celebrate the accomplishments of your class during 2020, the year designated by the World Health Organization as the Year of the Nurse and Midwife. We're living in unmanageable times for society and for nursing education. You should take pride knowing that your accomplishments and your achievements will become stuff of legend. You graduated during the pandemic. The class of 2020 also will have a special place in our heart, and you will be commemorated as part of the history of the School of Nursing. You have displayed great courage and have made many sacrifices to continue your education. What our current situation hasn't changed is what you've learned and the pride we feel in seeing what you have overcome to get there. You make us proud. Over the 70 years of the School of Nursing, we have educated thousands of nurses who have addressed and are addressing the health and healthcare needs of the diverse populations of Los Angeles, of California, the nation, and the world. We have strived for academic excellence and led in the advancement of scholarship and research. Our graduates have provided quality care to many, especially those in greatest need. In this day, in this time, society needs you more than ever. COVID-19 has not changed the dream you had when you started to become the best nurse possible, to become the best advanced practice nurse, or to become the best nurse leader or researcher. If anything, I hope that it has solidified your commitment. So wherever you go and whatever path you choose, I know you will make the world a better place. I hope to see many of you again as you pursue your graduate education at the School of Nursing. I am pleased now to introduce our keynote speaker, Dr. Katherine Alicia Georges, who is the National Volunteer President for AARP, the nation's largest nonprofit, nonpartisan organization dedicated to empowering Americans 50 and older to choose how they live as they age. In this role, Dr. Georges is the principal volunteer spokesman for AARP and a liaison between the board and those AARP serves. In addition to her duties representing AARP, Dr. Georges is a professor and chair of the Department of Nursing at Lehman College of the City University of New York and a volunteer president of the National Black Nurses Foundation. She is a fellow of the American Academy of Nursing. She is actually a living legend of the American Academy of Nursing. She's also a member of the New York Academy of Medicine. She's a lifetime member of the National Black Nurses Association and Alpha Kappa Alpha sorority. She earned her undergraduate degree from the Seton Hall University College of Nursing, her MA in nursing from New York University, and a doctoral degree in educational leadership and policy studies at the University of Vermont. Welcome, Dr. Georges.
Dean Linda Sarna, faculty, staff, family members of the graduates, and most of all, to the class of 2020. Good morning. Congratulations to all the graduates on your wonderful accomplishment. I am honored to have been asked to be your speaker in this, the International Year of the Nurse and Midwife, but also a year where we are experiencing a global event never seen before, the COVID-19 pandemic. But I say to you, do not be daunted because we are faced with this disease. You have chosen a profession where you will touch people's lives in such a profoundly positive way because of your excellent preparation. You will be a critical part of a healthcare field undergoing considerable change because of this pandemic and the effects of the economic downturn in our country. I can't tell you exactly how this will shake out in the next 10 years or even in the next year or two. But I think there are some fundamental truths that we can be confident about that will shape your work and the future of healthcare. One is demographic, Another is the influence of social determinants of health. And a third fundamental truth is the critical role of nurses, a role that I deeply believe has and will become increasingly important. Let's start with a demographic change. 10,000 people in this country turn 65 every day. By the year 2030, 1 in 5 Americans will be 65 years or older. By that time, we might have 1 million people age 100 or older. Our fastest growing age group in this country are those over 85. People want to age with dignity and purpose, and the overwhelming majority of them want to age at home. As we reflect on longer lifespans, we need to focus intensely on longer health spans, later years in which we are in relatively good health, able to keep working if we want to, and able to enjoy the gift of time. Many older people are having the time of their life. Many more could be. How we have managed the pandemic and its effect on the older populations are lessons learned for the future. We have to recognize and address glaring health disparities driven by long-standing social dominance that exist across ethnic, racial, socioeconomic, and geographic lines, often in defiance of most promising trends in the population as a whole. The COVID-19 brought this once again to the surface. Social determinants of health, which include areas such as homelessness, poverty, food insecurity, education, and social isolation, have once again intersected in this pandemic. Yes, it's vital to eat a healthy diet, exercise, maintain strong social bonds, but how do you take a walk after dinner or visit with a friend if you're scared? How do you feed your family if you live in a food desert? How do you take your prescribed medications if you can't afford them? How do you stay socially engaged if you're stuck at home because your friends have died or your family has moved away? We are all experiencing what so many have tried to cope with in the past. It's called social isolation. We're aware of the effects of social isolation, which can be more impactful than cigarette smoking. We've made very meaningful progress in healthcare through the passage of the Affordable Care Act. And it's now almost universally acceptable that people should be covered for pre-existing conditions. Now we need to build on that progress by making sure that social determinants of health are a central part of the debate and discussions about improving healthcare. As skilled listeners and trusted professionals, nurses are adept at addressing critical questions concerning these social determinants. Questions like, are the needs for nutrition and long-term services being met? Is a patient or family isolated or depressed? Are there family dynamics that have a negative impact on this patient's health? Why is the patient missing medical appointments? Is the sky-high cost of prescription drugs forcing the patient to choose between paying for prescription drugs or buying groceries, paying rent, or utilities? You will have a vital role in making sure we acknowledge and address social determinants. You will be critical to meeting the healthcare challenges of all populations as we provide transitional care, help to reduce rehospitalizations, inform and support America's 40 million family caregivers, and provide care coordination, chronic disease management, and preventive care. The central contributions nurses make will only grow as healthcare is increasingly provided in non-traditional settings. As I think about the many key contributions you can make as nurses, I also believe that one of them is resisting the biases that can creep into our healthcare system. In many parts of our country, your zip code becomes the manner in which you are treated, or as called healthcare disparity by location. Making automatic assumptions about patients is a barrier to providing good healthcare. The scope of your contribution will reflect your capacity for recognizing the individuality of every patient and truly listening. Listening, in my view, is the most underappreciated skill, and it is a skill that we refine through practice. Nurses are skilled listeners, and that's one reason nurses are well positioned to be leaders. Think of the many assets nurses bring to a leadership role. Technical knowledge through your studies and your practice. Trust. For over 17 years, the Gallup poll has found nursing to be the most trusted profession. The ability to keep a clear head under pressure, understanding the principles and the value of teamwork, the capacity to provide comprehensible, jargon-free explanation, and a close-up view and insights into the problems your patients face. As you think today about your new degree and where you're headed next, I'll ask you to consider for a moment where you will be in a few years and the skills and the experience you will have gained and how you can put those assets to work in different arenas. I urge you in your careers to share your perspective, to look for opportunities for leadership, to find a place at the table where policies are set. No seats, bring your own chair. I urge you to use your voice. Nurses are pivotal to building a culture of health in our country, a culture that embraces prevention as well as treatment, a culture that seeks to shed biases, a culture that meets head-on the external factors that produce such inequitable outcomes. To truly exercise that pivotal role, you must use your voice. Our communities and our country need to hear the voices of nurse leaders, not only in the hospital room, but in the boardroom, in the committee room, in the legislative chambers, where budget and policy decisions are made. We need to hear the voices of nurses on the social determinants of health. Maybe someday you'll even take on an entrepreneurial role, pulling together a business with other nurses. After all, the portended consolidations and other structural changes that are inevitable during and after this pandemic will create new models in healthcare delivery. That will affect nurses as well as hospitals and doctors. You can shape what they should be. Being resilient and having a sense of humor about life and yourself are indispensable. Taking on a leadership role can be daunting, but probably easier than the challenges you've already conquered, like taking courses at UCLA. Use your knowledge and use your voice as we seek to create a culture of health. Your patients, your community, and your country need you. When more and more nurses speak up, we will set in motion an unstoppable wave of change. Your influence in private settings and in public policy will reinforce each other. With this degree in hand, you are setting your direction by a moral compass. I want to leave you with some words from a poem that I use called Life. It goes like this. It says, find a passion and pursue it. Fall in love. Dream big. Spend quality time with family and friends. Laugh every day. Believe in magic. Tell stories. Reminisce about the good old days, but look with optimism to the future. When possible, travel often. Learn more. Be creative. Never give up. Do what you love, but be true to who you are. Make time to enjoy the simple things in life. Forgive even when it's hard. Smile often, but be grateful. Be the change you wish to see in the world. Try new things. Work hard. Don't count the minutes, count the laughs. Remember to embrace change. Trust in yourself. Be thankful. Be nice to everyone. Be happy. Live for today. And above all, make every moment count. Thanks for inviting me.
Thank you, Dr. Georges, for that inspiring keynote. Graduates of Masters of Science Advanced Practice program are practicing registered nurses who return to school to obtain the education and credentials required to engage in advanced practice nursing, including the roles of the nurse practitioner and the clinical nurse specialist, with emphasis on specialty population of interest. The advanced practice nursing role extends beyond the traditional role of registered nurse to include diagnosis, assessment, and formulation of treatment plans, as well as management and leadership. The class has chosen Helen Cordova as their speaker.
Good morning, family, friends, and of course, the graduating class of 2020. My name is Helen Cordova. We have finally made it to this glorious chapter in our educational careers. Though the course was not exactly what we had planned for, thank you COVID-19, the fact of the matter is that we were able to prevail and reach the finish line. Before going forward, can we take a moment to recognize all of our frontline workers, some of which handle taking care of COVID patients while simultaneously being in school? In thinking about what sort of theme this speech could have, I reflected on the past 2 years and drew inspiration from one of our favorite nursing theories, the Schuler model. This is where we all cringe a little and remember all the soap notes written when we manically search for a Schuler diagnosis. It got me wondering, is there perhaps an unwritten framework that relates our experience at UCLA? After some thought, it came to me, the Bruin APRN nursing model. We like our acronyms. APRN is shorthand for Advanced Practice Registered Nurse. So now we're all on the same page. Like Schuler, the Bruin APRN nursing model accepts the fact that the Bruin student, that's you and I, is a dynamic individual influenced by our external factors in response to our internal turmoil. In our case, the internal turmoil is a never-ending question of, why did I sign up for this? Or, why did I think this was a good idea? The key difference between these two frameworks is that the Bruin model is centered around the characteristics that make up a UCLA-prepared APRN. The first is physical endurance. And no, I'm not talking about the ability to walk up the stairs and not feel short of breath. I'm talking about the physical endurance it takes to successfully complete a 10-page paper the night before it's due, complete with references in APA format, of course, and then show up to class at 8 a.m. ready to discuss the treatment for hypertension. That, I tell you, is a physical endurance that will help many of us get through this program. But beyond this classroom setting, I believe that this physical endurance is going to shape us into some of the most hardworking and dedicated providers. The second trait of a Bruin APRN student is our dynamic nature. Can we take a moment and think about our very first day of clinical? Yes, the nervous feeling of, what am I doing here? Or, what am I supposed to do with the HPI? Seems like a lifetime ago, right? And now, if we think about our last day of clinicals, we sort of know what we're doing. We have evolved and developed into strong future providers because rather than remain static in our interactions and experiences, we tapped into our dynamic nature and flourish. Lastly, the final trait of a Bruin APRN is resilience. In the year that was supposed to not only celebrate our profession as nurses, but also be a culmination of 2 years of extremely hard work, the universe threw us one of the greatest curveballs imaginable. Everything that was so certain and finite suddenly became fluid and uncertain. And if there's one thing nurses love, it is order and plans. But rather than sit in a place of uncertainty, we did as the saying goes, we rolled with the punches. We adapted to changing clinical practices, hello telemedicine, managed our work stress while keeping up with school, and responded to a pandemic with the rest of our healthcare community. Talk about resilience. So as we begin our careers as APRNs, in those moments of self-doubt, remember how far you've come. So there you have it, the Bruin APRN nursing model, one that is built on the characteristics of physical endurance, dynamic nature, and resiliency. It is a framework that will help each and every one of us be incredible providers. So go Bruins, and congrats class of 2020. We did it.
Hi, I'm Dr. Barbara Bates-Jensen. It's my pleasure to present the 2020 candidates for the Masters of Science in Nursing degree. I will state each candidate's name, any honors or awards received. I will present each advanced practice specialty separately. Here are the candidates for the Adult Gerontology Acute Care Nurse Practitioner. Fatima Ashik. Maral Bakir, Sigma Theta Tau. Youngying Chen, Sigma Theta Tau. Jinso Choi, Sigma Theta Tau. Sarah Chow, Sigma Theta Tau. Leah Christian. Bethany Elise Francis. Carolyn Gonzalez, Sigma Theta Tau. Jessica Hangy, Sigma Theta Tau. Justin Keller, Sigma Theta Tau, Alpha Tau Delta. Ruby Rose Dayrit Kudelek, Sigma Theta Tau. Whitney Lamb, Sigma Theta Tau. David S. Lee, Sigma Theta Tau. Christina Pulliam Markey, Sigma Theta Tau. Guyane Merchant, Sigma Theta Tau. Jenny Mo. Gazelle Nori, Sigma Theta Tau. Jonas Fortin Obispo, Sigma Theta Tau, Alpha Tau Delta. Norma Gabriela Oriana, Sigma Theta Tau. Margaret Pang, Sigma Theta Tau. Kate Parfrey, Sigma Theta Tau. Jen Paulo, Sigma Theta Tau, Alpha Tau Delta. Charla Megan Perez. Sarah Rhodes. Maria Teresa Sanchez, Sigma Theta Tau. Yen Yi Shen, Sigma Theta Tau. Desiree Shin, Sigma Theta Tau. Jusun Shin, Sigma Theta Tau. Christy Tamer, Sigma Theta Tau. Anna Trejo, Sigma Theta Tau. Christopher Earl Vincent. Here are the candidates for Adult Gerontology Acute Care Nurse Practitioner and Clinical Nurse Specialist. Mary Grace Conserman Gayos, Sigma Theta Tau, Alpha Tau Delta. Patricia Omegi Manassas Ilare, Sigma Theta Tau. Allison Claire Lutfi, Sigma Theta Tau. Michelle Devea Padre, Sigma Theta Tau. Lindsay Ritter, Sigma Theta Tau. Samantha Thomas, Sigma Theta Tau. Monica J. Yoon, Sigma Theta Tau. Here are the candidates for Adult Gerontology Primary Care Nurse Practitioner. Katherine Chan, Sigma Theta Tau. Sherry Ichano. Crystal Kim. Nicole Mateo Lickup. Inez Allegra Sabio. Yoli Salazar Turnbull. Hannah Song, Sigma Theta Tau. Yoko Yamani, Sigma Theta Tau. Here is the candidate for Pediatric Clinical Nurse Specialist. Jennifer Busca, Sigma Theta Tau. Here are the candidates for Pediatric Nurse Practitioner. Christina Marie Clack. Jessica Nicole DeWitt. Amanda Mendelis, Sigma Theta Tau. Rhea Salagumba. Here are the candidates for Pediatric Nurse Practitioner and Clinical Nurse Specialist. Julia Linesh, Sigma Theta Tau. Claudia Alicia Rodriguez Zinn, Sigma Theta Tau. Here are the candidates for Family Nurse Practitioner. Armina Avakian, Sigma Theta Tau. Valerie Barkin, Sigma Theta Tau. Sheila Chi. Helen Cordova, Sigma Theta Tau. Tracy Ginsburg. Armina Gukasian. Jamie Joyce Martin Hermosura, Sigma Theta Tau. Dejanae Jackson. Nancy Jew, Sigma Theta Tau. Sherry Kamisian, Sigma Theta Tau. Jeannie Yuen Mong Lee, Sigma Theta Tau. Alexander Lee, Sigma Theta Tau. Wendy Macedo, Sigma Theta Tau. Anna Liapina, Sigma Theta Tau. Lizette Medina, Sigma Theta Tau. Linda Oak. Therese Parsa. Megan Pereira, Sigma Theta Tau. Diana Petros, Sigma Theta Tau. Stephanie Payakovsky. Fibadel Castro Reyes, Sigma Theta Tau. Veronica Rivera Santos, Sigma Theta Tau. Tara Schaefer, Sigma Theta Tau. Yvonne Shi, Sigma Theta Tau. Carmel May Salutan Silveo. Annabellen Taylor. Karina Tarasian, Sigma Theta Tau. Joy May Wagner, Sigma Theta Tau. April Shi Wu, Sigma Theta Tau. Joshua Daniel Yap.
Will the candidates please rise? By the powers vested in me by the Regents of the University of California, I bestow upon you the Master of Science in Nursing degree and all the rights and privileges thereof. Congratulations, graduates.
In full knowledge of the obligations I am undertaking, I promise to care for the sick with all the skill and understanding I possess,
without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering, and to promote health.
I will respect at all times the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refrain from any action which might endanger life or health.
I will endeavor to keep my professional knowledge and skill at the highest level and to give loyal support and cooperation to all members of the health team.
I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the professional nurse.
I want to take a moment to say thank you to the faculty and staff who worked so hard to produce this, our very first virtual commencement. Doctors Barbara Bates Jensen and Nancy Jo Bush read the student names. Shelley Shepard, Janet Kang, Stephanie Dominic, and Sue Kwong provided support from student affairs, and Laura Perry did a stellar job from communications. Thank you. But now I want to recognize all of you who have helped these graduates achieve their goals. Thank you to the spouses and significant others. Thank you to the parents and the grandparents. Thank you to the children. And thank you to the other relatives and friends watching today. Thank you all. Thank you so much for joining us today, and best wishes to the new degree holders.